order for Monday, August 21st, 2023, Behavioral Health Advisory Board General Meeting. I'd like to ask our interpreters, Lorena and Priscilla, to give us the translation guidelines, please.
Okay. Hello. We are Priscilla and Lorena, and we will be providing simultaneous interpretation services for the meeting today. You can access the interpretation services by clicking the globe icon in the bottom of your Zoom screen and then selecting either English or Spanish. Everybody should select a language. And we do ask that when speaking to please be mindful of our simultaneous interpretation, to speak slowly and clearly, and to try to avoid interrupting or speaking over another speaker. We will signal you with the raise hand symbol on Zoom if you're speaking too fast and need to slow down, or by turning on our cameras if you need to speak and enunciate clearly. Please pin us on Zoom so that you can identify us as your interpreters. Thank you for keeping the interpretation services in mind while conducting and participating in the meeting. Your assistance is very much appreciated. And now Priscilla will go ahead and say the same message in Spanish. Thank you.
Buenas tardes a todos, somos Lorena y Priscila y vamos a ser sus intérpretes en la reunión de hoy. Pueden acceder a los servicios de interpretación haciendo clic en el icono con forma de globo en la parte inferior de sus pantallas de Zoom y seleccionar inglés o español. Todos deben seleccionar un idioma. Les pedimos que cuando hablen tengan en cuenta la interpretación y que lo hagan de forma clara y lenta y eviten hablar encima de otro orador. Utilizaremos la función de levantar la mano si están hablando rápido o encenderemos nuestras cámaras si necesitamos comunicarnos con ustedes. Pueden fijarnos en sus pantallas de Zoom para identificarnos como sus intérpretes. Gracias por tener en cuenta los servicios de interpretación mientras conducen y participan en esta reunión. Thank you.
Thank you very much. And along with the translation guidelines, I just wanted to mention that everyone could speak slowly and succinctly, so that the translator can translate our words. So she could translate our words as they're said. We're finding that a lot of times in the crawl it's miscommunicated what it is that we're saying. So if we could speak slowly, hopefully we won't have that problem in the future. Thank you. Okay, next we have the quorum roll call and introductions. All right, first I wanted to say welcome to our online guests and participants today. We appreciate everyone's input. Before we call the roll, I would like to thank our former chair, Michael Rodriguez, for his excellent leadership the last 2 years. Michael, we look forward to hearing from you as the Chief Deputy Defender, Public Defender, and also as the Chair Emeritus, and we very, very much appreciate your wonderful leadership for the last 2 years.
Thank you, Janice. Appreciate it.
All right, Jennifer, would you like to call roll?
Absolutely. Claudia Armon.
Here.
Soledad Barragan.
Here.
Nancy Borchard.
Here.
Kevin Parisi.
Here.
James Espinoza.
Here.
Genevieve Flores Haro. Cheryl Whiteman.
She's going to be late.
CJ Keatley.
CJ Keaton is on Zoom today.
Supervisor Levere.
Here.
Nomi Marufu.
Here.
Diane Clay. Here. Jennifer Morrison, present. Sean Pusey.
Here.
Delia Robkin.
Here.
Michael Rodriguez.
Here.
Elizabeth Stone.
Present.
Marlon Torres. Liz Warren.
Here.
Janice Carter.
Here. Thank you.
We have one.
We have a quorum. Thank you. We can proceed with our action items. That's great. All right. Jackie, are there any absences for just cause or emergency?
No, not that.
All right, great, thank you. All right, may I have a motion to approve today's agenda, please?
Some.
Second.
Moved by Michael Rodriguez and seconded by Diane McKay. Are there any changes or additions to the agenda? I would like to make a motion to possibly move our committee reports to next month. But I would like to, so that would be the motion, and I would like to have a discussion, but once it's seconded, I'd like to have a discussion with the committee chairs and see if it's okay with that.
Second.
All right, so we do have some committee chairs here in the room today. Is it okay with you if we run out of time? Kevin, it's okay with me? All right, anyone else? All right, so hopefully we can get through everything today in a timely manner and we won't have to move them, but. So I will, so that motion is approved as a possible movement of the committee reports to later, to next month. Awesome. Okay. There we go. All right, so next we have, may I have a motion to approve July 17th minutes?
I think we've taken a vote on the agenda.
Oh, we didn't have, I'm so sorry. I'm sorry. Okay. Jennifer?
Claudia Armand,
Yes.
Soledad Aragon,
Yes.
Nancy Borcher. Yes. Kevin Parisi,
Yes.
James Espinoza,
Yes.
Genevieve Flores Haro. Oh, we said she's not here, right? Right. Excuse me. Cheryl Heitman is late, CJ Keeley. She doesn't vote. Thank you. Supervisor Levier,
Yes.
Novi Maruko,
Yes.
Diane McKay. Yes. Jennifer Morrison, yes. Sean Pusey,
Yes.
Delia Brockman,
Yes.
Michael Rodriguez,
Yes.
Elizabeth Stone,
Yes, as amended.
Liz Warren,
Yes, as amended.
Janice Gardner.
Yes, as amended. Okay, so the motion is approved as amended. All right, public comments. Are there any public comments from anyone on Zoom or? Oh, I'm sorry. Okay, all right, so sorry. May I have a motion to approve July 17th minutes, please?
Move approval of the minutes. Second.
Is there any discussion or conversation, ideas, changes in the minutes?
Yes,
Go ahead, Liz.
thank you. It's a slight change. It is, under old business, letter A, a Ombudsman recommendation approval letter. It should read first Vice Chair Warren, and then it should read, the BHAB Ombudsman Work Group recommendation letter for approval.
All right, first and second, do you approve? I approve of the first. The seconded the motion.
I did. Yes.
All right, motion approves, the motion is approved as amended. Thank you very much. Now we have a vote. Jennifer?
Claudia Armand,
Yes.
Soledad Aragon,
Yes.
Nancy Borcher. Yes. Kevin Parisi,
Yes.
James Espinoza,
Abstain.
Supervisor
Yes.
Novi Maruko,
Yes.
Diane McKay. Yes. Jennifer Morrison, yes. Sean Pusey,
Yes.
Delia Robkin. Yes. Michael Rodriguez,
Abstain.
Elizabeth Stone,
Abstain.
Liz Warren,
Yes, as amended.
Janice Gardner.
Yes, as amended. All right. All right, so the motion passes as amended. Next, we have public comments. Are there any public comments? Please be advised that public comments may be heard on any agenda item. So if you would like to make a public comment, please raise your hand on the prompt if you would like to speak. and we'll recognize you on any agenda item. Thank you.
Janice, there are 2 written comments that I have here.
Thank you, Jackie. Would you read them, please?
One written comment is from Pete Lafoyette. Really important that the stakeholder oversight placed in the disbursement of funds, that it actually goes where lawfully intended and not become another Cadillac rollout for contractors, consultants, advisors without getting around to the actual supported housing. There are no uniform governing authorities for MHSA on county by county basis, which has led to obfuscating of funding which would apply to CARE Corps initiative. Also, those counties with political clout could monopolize funding if no uniform criteria is being met as well. If no recovery modeling in place, for example, no sobriety or behavioral treatment required. Critics of plan could cite blight on the community or warehousing with no demonstrated outcome beside basic survival needs being met. Of course, we MHSA stakeholders desire homelessness addressed, but funds are for specific use such as SMI, not to solve broader societal ills. There is not enough anywhere to apply to the broad middle class, slippage experiences everywhere now. And the next written comment is from CC Casey. Hello, I am CC Casey, a family member who was once a mental health board member in 2005. An amendment AB 459 to the Bronson McCourt-Dale Act realigning funds from state to county. The county is to consult with designated agency stakeholders to address individuals with mental health disorders who meet the target population. It further states that it is up to the counties to determine whether SUD is to be included in the stakeholders process for funding to the BHAB target population. It specifically states that county behavioral health agency partners shall be determined by the county and may include, but are not limited to, drug and alcohol programs, etc. This county chose not to include individuals with thought disorders like schizophrenia after implementing the 2004 MHSA. It was devastating to them and families. It is time, as advised by Governor Newsom, to address the most seriously mentally ill individuals who are homeless or at risk of becoming homeless, categorizing functional impairment to housing needs. There is much discussion that outpatient services to SMI will be cut if SUDs are added. The severely mentally ill need accountability and oversight with their own funding stream, as I have advocated for in the past. About a quarter of those with schizophrenia have severe symptoms, even those who take improved medications and have neurocognitive disturbances like memory, attention, concentration, organization, and planning that affects cognitive functioning, leading some to be resistant to treatment. Provide funding and accountability for 120-bed MHRC augmented boarding care, CSU, evidence-based full service partnership, and to retain and add to the already provided outpatient services to treat those who are severely and mentally ill. Thank you, Cece. That is all.
Thank you, Jackie. Very much appreciated. I apologize to the board and to our members who are participants this morning for my being not exactly perfectly on my game today. Something happened this morning, which was a little upsetting, but we're going to carry on. And next, there are chair comments. Deputy District Attorney Rochelle Dean responded to a question asked by a BHAB member during the District Attorney Nasarenko's presentation. Her answer is as follows, quote, our mental health unit is comprised of 5 attorneys and each handle approximately 50 cases. These cases consist of civil commitments, gun forfeiture hearings, veterans court, mental health diversion, and incompetent to stand trial matters. So that is her response to the question. I don't recall who asked it, but yes, Liz.
I did ask a question. It's very nice of you to get back to me. Can I get a copy of what you're reading, just because you're rattling it off a little fast and I couldn't get all that? Sure. That'd be great. Thanks.
No problem at all. I'll send it out. Thank you. Okay, we have quite a few very important events coming up, but our Secretary Jennifer will be speaking about these. And we also have flyers on the table for quite a few of them. So please pick the flyer up, and most of them do require registration. So please take a look at the flyers and do the square or email or whatever is required, but very important events coming up in September for all of us. As discussed during the BHAB executive meeting, for the request of numerous BHAB members of the community and county staff, in order to end the meeting on time and streamline the agenda and to allow everyone to have a voice and be heard during board member comments, we'll be adding a process of reducing board member comments to 3 minutes per speaker. We'll be doing that in a round robin format, which was discussed. And that means that the first speaker would speak for 3 minutes, and the second speaker, third speaker, and then we would circle back to the first speaker, so they would have another 3 minutes to speak. And you know, that I think that we've been in the past years, we have had a 3 minute per speaker on the agenda, and so that is how we're going to be proceeding going forward. And so everyone will have a chance and they can speak multiple times if we have time, which hopefully we will, because we're all here to have a voice. And that is what we're trying to do, is to have our voice heard. I also wanted to mention, it's not in my notes, but I wanted to mention that each of us, every single one of us sitting at this table, and a lot of the participants on Zoom also, were appointed by our county supervisors, including Supervisor Revere, to speak for the residents and the community, because some of our community are not residents in Ventura County. And so I just want to say thank you to everyone, and please speak up. We want to hear what you have to say. And it's important that we work with the VCBH, because we are behavioral health. We work with other agencies as well. But I think that I just wanted to mention that we are accountable to our supervisors, and we appreciate being appointed by each of you. Thank you. Okay, so let's see if there's anything else. Nope. Next we have the time certain. Is it 1:30? Oh, I lost on ahead of time. Next, we have a time certain presentation from Eval Corps entitled Preliminary Findings from Provider Key Stakeholder Interviews and Listening Sessions. As each of us know, Eval Corps called a lot of the community and BHAB members and folks all around Ventura County and spoke to them about what our gaps in services might be and other things, but I'm not going to speak for them. So if Kristen Donovan, Dustin Anderson, and Ray Hampstead would like to take the floor, please do. So Kristen.
Thank you, Chair Gardner. I'm Kristen Donovan, and I'm the Executive Director at Eval Corps, and we've had the honor of being selected as the contracting agency to do the needs assessment for the healthcare agency. I have multiple members of my team here today, and we're happy to share with you some information that was gathered through our community stakeholder process. And with me today is Alex Aguirre from my team, and she will be presenting findings to you. Please do not hesitate to ask us to speak more slowly. I know Alex will do a great job of that, but if there's questions that come up as we're presenting, please don't hesitate to ask. And we also built time into our agenda today to answer questions at the end of Alex's presentation. Thank you again, and I'll turn it over to Alex.
Oh, perfect. Hi, thank you everyone for giving us this opportunity to be here remotely. I do want to acknowledge the abnormal weather patterns we were having and earthquakes up in Ohio. So I really hope everyone is safe and any damage is minimal. And like Kristen said, we are here to present on the continuum of care needs assessment that we're currently conducting in the county. We have three main objectives for this meeting today. First is to give you an overview of the needs assessment. Secondaries, we want to focus on those stakeholder interviews that we've been conducting, give you a little bit of a progress update and some preliminary themes that are coming up for us. And lastly, end with some listening sessions findings that we're also highlighting, and we'll be continuing to do those, but just want to share some preliminary findings. I do also want to acknowledge Chair Gardner and all of those that have been able to help us and contributed their time and efforts to our engagement with the broader community stakeholders, the county residents, and county community members. Thank you again to all those that have been able to participate in those conversations with us. And none of this would have been possible without the support of the healthcare agency and the support of Barry Zimmerman and the team out there. So thank you again. We're very grateful for the opportunity. So I want to jump right into the needs assessment recap. Just as a reminder, I want to give a brief overview of the purpose of the study that we're engaged in. Our objective is to complete a comprehensive needs assessment of the continuum of care across both mental health and substance use delivery services. This study seeks to understand the prevalence, utilization, and capacities of the systems, as well as how various populations engage with the systems. And as a note, because we are limited on time, I do want to be very respectful. And if it sounds like I'm zooming right past through certain things, please rest assured I will take questions at the very end, as well as be available via email. So just to review some definitions, as well as you'll hear me use community members, providers, stakeholders. So to understand what services are available and identify possible gaps, we spoke to these main interested parties. So providers and stakeholders and community members. You'll hear me interchangeably use provider, stakeholder. Those are really individuals that either deliver direct mental health or substance use services or facilitate and support the direct mental health services. And community members, of course, vary across different demographics, but they are current or potential users of any of these services. As for our data collection activities, we have a pretty complex engagement process that includes in-depth interviews, different listening sessions, and surveys. At the last debrief of our BHAB meeting, we spent some time talking through our approach. And just to sum up today, that we have been open to all voices, valuing inclusion above all else. We've made ourselves available to a lot of different community members and stakeholders through all times of the day, any day of the week, in person or remote, interviews and or listening sessions. Some started at 7 a.m. all the way till 8 p.m. And we held them both on the weekends and during the week to make sure that we were really able to capture as many voices whenever they were available to us. And as many of you have experienced, we are very persistent. We definitely want to get those voices, and we're committed to having a successful engagement phase. So we will continue with our persistence with your apologies and your thanks. And so just again, to remind you, the data collection activities that we'll be discussing right now are in the primary data section. So in-depth interviews, specifically stakeholders, community listening sessions, and just briefly surveys, but not too much on that this time.
Excuse me, can you hold on one second, please?
Alex, this is Supervisor Lunger. Just a quick question. Where do family members fall in kind of these definitions? Are they stakeholders?
Family members, I believe, can really be across all of those, because community members, of course, might have some direct or peer involvement with either system, as well as stakeholders that provide services or facilitate services. So I'm assuming our directed approach for community members, of course, I think that probably is the easiest way to include them. But I assure you that as people were discussing in listening sessions or in-depth interviews for the other stakeholders, they were definitely drawing from their own experiences as well. So short answer, all of them. Long answer, obviously a little bit longer, but I think I'll stick to the short answer.
Thank you.
Sure. So just reviewing the mental health delivery system, to reflect on the broad scope of this needs assessment. The continuum of care for mental health services covers a wide range of services from mild to severe and the providers of those services vary by different payer source or insurance types. You can see here that the primary provider of mental health services for individuals with private insurance is coordinated through their private insurance company. Gold Coast or Carolina is the Medi-Cal insurance company for individuals who have mild to moderate mental health needs. They're responsible for ensuring that services are through their treatment provider network. VCBH is both the Medi-Cal insurance company and can also be the treatment provider of mental health services for individuals with moderate to severe mental health conditions. VCBH also contracts with a variety of treatment providers in the community for mental health and substance use treatment. In their past, there has been some confusion and frustration over what system could best meet the needs of those seeking the services. One new requirement of CalAIM is the use of a universal screening tool to determine what system could provide the best services for individuals with moderate symptoms. Medicare covers mental health services for health professionals who accept their assignment. Uninsured individuals with mild mental health issues can access services through community clinics, private practice, but can also access VCBH services when moderate to severe mental health issues exist. The questions that we ask community members, providers of services, or stakeholders that facilitate or support care are directed at this entire system of services and the supports of the system. Now we'll go ahead and go on to the engagement process updates. We're really excited to share our progress with each of these data collection initiatives. We reached out to over 40 community members.
I'm sorry to interrupt, but there was a process question.
Sure.
We heard a few, maybe 2-3 months ago about community county workers or people that work for the county and provide services that are really in kind of a state of crisis, a lot of suicidality, and your kind of insurance payer source doesn't seem to reflect that. And I just want to make sure that, or would like to encourage you, as we're looking at the full continuum for all of the members of our communities, that you're going to be, excuse me, looking at their needs as well.
Absolutely. And I'll definitely make a note to that to see how we can ensure that we incorporate them into our overall needs assessment.
I think we should let them go through their presentation, and then please write down your questions and we'll get to you right away as soon as the presentation is over. Okay, thank you.
So as we move on to the engagement updates, we had reached out to over 40 community members and facilitated 20 in-depth interviews with community members. We also facilitated 45 in-depth interviews to 69 different stakeholders across the county. Those numbers obviously look a little bit different. It's because some of those were group interviews. So we have been inclusive of providers and stakeholders across the system that include treatment facilities, county agencies and departments, and community-based organizations. We'll discuss preliminary findings from these in-depth interviews shortly in this presentation. As for the community listening sessions, we conducted 7 of those in Ventura, Oxnard, Thousand Oaks, Santa Paula, and 4 of those were in Spanish. We have conducted 99, or we have incorporated 99 community members in these listening sessions. We are focusing on, or we have been able to focus on Hispanic and Latino communities, some transitional age youth communities, LGBTQIA, veterans, older adults, and we really tried to make sure we were getting representation from different regions of the county. And also because we know that not everybody is able to participate in interviews or learning sessions, we've also been able to do a brief survey available for community members to maximize the number of voices possible. We're in the beginning stages of distributing that health survey and have plans to distribute through many different channels, as well as in-person collection plans for with the healthcare agency at various community events. Lastly, we have shared a survey to various sectors of the county, including healthcare, education, the justice system, specialty courts, children and family services, law enforcement, first responders, diversity, resources, and community-based organizations providing mental health and/or substance use prevention and treatment services. And I think that definitely would go to the previous question of making sure that we're getting certain county workers involved as well. And again, I'm going through this very quickly, so please hold those questions to the very end. Before I jump into the preliminary findings from our in-depth interviews with providers and stakeholders, I'd like to share a little bit about who we spoke with. 86% of interviewees shared that their service area covered all supervisory districts or shared that they served both East and West County. 51% shared that their services support both mental health and substance use. 43% shared that they only support one or the other, and 6% were only mental health, and 6% were substance use services only. 97% of providers interviewed shared that their services are offered in both English and Spanish. Providers represent diverse sectors. I mentioned a couple before, and we're.
Chair Gardner, could you please ask whoever has their telephone on right now to please turn it off, or?
It's coming from administrative. It has nothing to do.
Okay, it sounds like a phone is going on.
No one's.
Okay, well, I apologize. Alex. Thank you.
It's okay. I think it's whenever anybody joins the meeting. So moving on to our second point on the agenda, I'd like to share these preliminary themes. Findings are organized by these 4 categories: mental health, substance use issues, barriers to care, services, needs and gaps, and recommendations. So stakeholders mentioned specific mental health conditions when they were asked. Some of these included specific conditions such as schizophrenia, bipolar disorder, depression, as well as for substance abuse or substance use conditions like opioids and stimulants. When asked about prevalent mental health issues in the county, we were looking for the particular conditions that they say were most prevalent, which we discussed in the prior slide. However, stakeholders also responded with other issues related to access and engagement that were underlying some of those conditions. The first of which, access to treatment, the timeliness of the treatment availability, collaboration and coordination amongst different agencies and service providers and resources found in the community, as well as support for very specific vulnerable populations. Some of them we mentioned already, but they also include homeless individuals, non-binary youth, or individuals with developmental disabilities, and those within the justice system. Stakeholders highlighted several barriers that are most in need of addressing in Ventura County. Therefore, the first 4 that we have here are access and availability of services, stigma and shame, transportation, and systemic issues really cut across both the mental health and substance use systems. But more specifically, mental health stakeholders reported cultural and linguistic barriers and a responsiveness and knowledge of different providers out in the community. Similarly, substance use stakeholders identified a lack of information or resources available to them. And looking at the specific mental health service needs, mental health stakeholders mentioned issues that include the following: access to mental health services, so needing an improved system of access. It was consistently mentioned across the responses, highlighting the challenge of accessing timely and adequate mental health services, crisis services and crisis intervention, so the need for beds, specifically crisis beds or short-term crisis services, housing and the continuity of care, the importance of stable housing, including board and care facilities, as well as some transitional support for individuals that are leaving locked facilities was mentioned. Mental health needs in the legal system was also highlighted. This theme focused on addressing the specific mental health needs of individuals involved within the legal system, ensuring that their mental health needs are adequately addressed and supported. Additional or key to that was an identification of a time that was highlighted that was very important, which was at time of release. Many providers share a deep desire for better support of the justice involved at the time of release to ensure that they have collaborative efforts and successful transitions back out into the community. The substance use service needs and gaps of services included a lack of local treatment options, a focus on specific populations, many of which we've already mentioned, like homeless populations, opioid and stimulant use and medication-assisted treatment that help to support an individual to address some of those opioid use disorders and helping individuals reduce or eliminate their dependence. Access to services and the continuity of care, again, emphasize the importance of improving the access to services regardless of insurance coverage, and ensuring continuity of care throughout the treatment process. And lastly, prevention, education, and awareness. A lot of these recommendations that came from stakeholders, both within the mental health services and the substance use services, the provider shared many recommendations, and they arose as most prominent throughout all these conversations we have listed here. Many of these are extensions of the needs and gaps that we already discussed. So a need to increase staffing or funding, enhance crisis services, foster additional collaborations and partnerships with both community and county resources, focus on prevention and early intervention, address disparities and cultural competence and proficiency, improve access and timeliness, and staff training and retention. We'll end our presentation today with the preliminary themes from our listening sessions. Before I jump into those findings, I do want to discuss again who we engaged with. We have been able to reach 99 people across our sessions. 4 sessions have been facilitated in Spanish. The participants have been diverse across various demographics, including age, which with an average age of 27 and the region of residence. So we really wanted to make sure these listening sessions were conducted in various locations throughout the county. Outreach strategies have been focused, like I said before, on Hispanic Latino communities, transitional age youth, and we have a couple coming up for LGBTQIA communities and veteran communities. The community listening sessions revealed barriers that closely align with what we were hearing from the stakeholders, confirming for us that we were reaching out and engaging with a diversity of community members and other stakeholders. So the first of which, stigma and fear. This was the most frequently mentioned and significant theme. It involves the fear of being labeled, judged, or facing these negative repercussions from family or community members. A lack of awareness and information. Many interviewees highlighted a lack of knowledge about available mental health services. Access and availability issues. Even if they are aware, they encounter various barriers to being able to access, one of which being financial barriers and another being cultural and linguistic barriers. Similar to the alignment and barriers, community listening sessions and stakeholder interviews were consistent with each other. There are maybe some nuanced differences that can be seen. For example, stakeholder responses were more logistically focused, while community listening sessions understandably gave recommendations that were more about community education and engagement. Noteworthy across all these were an emphasis on a lack of or a need for funding. So they focused on some education and prevention, community engagement and socialization. So encouraging socialization and creating opportunities for people to meet and engage with each other. Language and cultural competency and proficiency, having staff that speak the language of the community and are culturally aware of the community's needs. Tailoring communication to be accessible and understandable to everyone. Funding and resource allocation, like I mentioned, that was a pretty prominent one across both stakeholders and community members. And accessible and localized services, bringing mental health services closer to the community and having more diversity and availability of those resources within the community, supporting social workers in schools and expanding their presence, advocating for increased funding and support for schools. And lastly, supportive community networks, recognizing the importance of community support and addressing mental health needs, and leveraging faith-based communities and churches to provide support, and promoting cultural and collective support and collaboration among various resources. Again, we are so grateful to be partnering with the healthcare agency on this project, and we have a strong and capable team fully committed to ensuring these final reports and reliably representing the county voices and needs. That goes to our persistence, and we want to make sure that we're incorporating all those voices. So thank you so much for bringing up the county workers, and I open it up to questions and hope that you're able to reach out to either Dr. Donovan or Dr. Anderson if you have any additional questions not addressed today.
Thank you, Alex. Thank you, Kristen. Thank you, Ray, and the remainder of Dustin as well for all of your hard work. We really appreciate all of the efforts and the time that you put in. And I know that we have quite a few questions from the floor. So if you could ask one question at a time, and then we'll circle back to you for a second or third question. Go ahead, Michael.
Good afternoon. Thank you for your presentation. I had a quick question. How many respondents participated in the surveys?
So far, we have about 98. That was as of yesterday. And like I said, we are trying, we're definitely having different opportunities to push that community survey. We're going to be doing those in-person opportunities with different county or community agencies, and as well as having different outreach efforts from community resources.
Thank you for the question, Michael. I'd also like to add that our focus has actually been on the stakeholder survey initially. We have rolled out the community survey, but I'm going to actually ask Alex Icaza Herrera from our team to give a quick update on how many surveys have been collected from stakeholders.
Thank you for unmuting me. Yeah, great. Thanks, Dustin. As of this morning, we had over 700 respondents on the provider survey. I believe it was at 716. And we are still making some efforts to get additional provider input on this survey. So we're making really great strides for that portion of our engagement effort.
Yeah, thank you.
Okay, thank you. Mary, I see you, but Nancy Borchard had a question first.
I was just wondering, you have way back at the very beginning, listed some, I just wondered the community people that, okay, wait a second, where did I write this? Oh, community clinics, and could you tell me what clinics you spoke there?
I'm sorry, can you repeat the question?
When you were talking, or that people could go to community clinics, what, could you tell us what clinics you actually spoke with?
Oh, you mean for the insurance on the insurance payer, payer source? So I know of, we spoke to at least one clinic, the Westminster Clinic, but there are various ones. Dustin, do you have any more information on other clinics that they might, community members might be able to access?
You know, I don't have that list available right now, but if you email me, then I'll get you the list of clinics that we spoke with.
Right, thank you. I appreciate if you could please email us, and we will make sure that the BHAB has your email and your answers. Okay, that was her question. Go ahead, Mary Hefner.
Hi, good afternoon. Thank you for the presentation and the information. When we first decided as a BHAB to ask the county supervisors to direct that an assessment be made, we had been focusing on the population of people with the most serious mental illnesses, people who cycle through the system, through homelessness, through successive hospitalizations, and the law enforcement, people in crisis that are continually cycling. So I see that the scope has changed, but what I would like to know is if you have done any research on the data that would discuss the number of calls that people make who are in psychiatric crisis a year, and the different crisis calls that are made, and then how many administrative days people spend at Hillmont waiting for a step down. Because what we were trying to do is figure out how many beds, how many slots we need in each continuum, so that the system is not clogged with people with serious mental illness and they don't just end up in jail. So have you done that kind of research?
Yes, and we are going to be sharing that phase of the assessment with our secondary data collection, where we will have, you know, prevalence and utilization of service data. So that's something that is ongoing for us.
Yeah,
Thank you.
I'm really glad, Mary, that you brought that up. One thing we could have said at the beginning is that the project is broken into multiple phases, and we opted to start in phase 1, talking with people. So through the interviews and the listening sessions, and then the survey is kind of phase 2. The next phase, and we've started pulling some of the metrics you're talking about already, but we certainly do have phase 3, which is going to be getting those metrics that you're talking about how many calls come in and the number of beds and how long people are having to wait. So please know that, our project goes through June 30 of next year, and we'll absolutely be reporting on exactly what you brought up, Mary. Thank you.
Thank you, Kristen. All right, we have a couple of questions here from our BHAB members in person. Chris Tejeda, I recognize you, but James, go ahead.
Okay, well, thank you for your presentation, much appreciated. My name is James Espinosa. I'm a veteran representative, military veteran on the BHAB. Also, I'm an active first responder. I was just kind of curious what the numbers were, how many veterans you spoke to, and what era they were from. By that, I mean Vietnam, Gulf War, post 9/11. And then also, if you can let me know if first responders were included in that as well.
Ray, do you want to take that question? You facilitated the list, or was in the listening session with our veterans.
Yes, well, in addition to some individuals with whom we spoke, we had a listening session in Oxnard, and the questions we asked did not include area of service. So they were asked similar questions to everyone else about their needs and experience seeking services. Was that your question, Chris?
James.
James, so.
Oh, James, I'm sorry.
I could do those, maybe have an offline conversation. I'm pretty well connected within the veteran community. If you need more veterans to talk to, I am one. I'm also a first responder, and I might be able to get more respondents from that demographic for you.
Yes, thank you so much, James. And we definitely welcome any support and help we can get in making sure that we're reaching out to the necessary people involved in our whole assessment. So please, definitely, we would love the help with that. And also to add on to what Ray was saying, our survey also includes an option for indicating whether or not they're veterans. So we're also getting additional veteran voices through the community survey.
And we could absolutely use everyone in this room's help in pushing our community survey out further. And so, James, we'd love to get your contact information, because I think sometimes when a peer or someone, a trusted source, asks someone to share their opinion through surveys, it will also increase our ability to hear from more folks. So thank you, James.
One thing I would add, for first responders, specifically law enforcement, confidentiality is critical. And then with veterans, a little different, hit or miss, and a lot of times they're more willing to talk to veterans than they are non-veterans.
Absolutely,
Okay.
thank you for that.
James. Okay, who is next? Elizabeth? Oh, great, Elizabeth. Okay, Chris, go ahead.
Hi, thank you for unmuting me. Are you able to hear me okay?
Yes.
Okay, thank you. I just wanted to say, yeah, thank you for the presentation. And I was following along, and I was also following along with the final contract, entered into with the Valcor for the needs assessment. And thank you for describing the different sections of the task, because I think that's helpful to understand where we're at and where we're going to go. And I just wanted to highlight going forward the importance of task 3, the data collection and analysis. And that's on page 15 of the Valcor final contract. And this includes items such as analysis of prevalence and utilization trends, identifying and outlining the existing treatment needs, projecting utilization trends and projected growth, determining gaps in services, analyzing the efficiencies in client flow across resources and access points, recommendations on how to better utilize these areas. And then it also goes into the secondary data with stakeholders and the flow of information across different agencies in the county. So I just wanted to highlight that I'm very interested in this data and how this will be. I know it's a long process, and like you said, we'll be going through in June, but I think this is really where we're gonna really be able to have good information that could help us lead to informed decisions moving forward. So if this finalized contact could be sent out in the minutes, that would be really great for everybody to be able to refer to and just know what's coming and the kind of the schedule as well. So thank you for this. I appreciate it.
Thank you.
Thank you, Chris. Of note, when we began, the directive shifted the timeline. So I will note that everything in our contract will be completed. However, the outreach to community was prioritized by the healthcare agency. So that piece, some of the timelines have shifted a bit, but everything will get done.
Thank you so much. I appreciate it.
Yeah,
Thank you. Thank you.
And I just wanted to add as well that so much of the community contact and the stakeholder contact that we're doing in person or remotely is, I believe, really setting us up to be able to help with paint a larger picture and more context to a lot of the data that we're going to be analyzing through the secondary data sources, because we've already found that stakeholder recommendations and barriers and everything they're highlighting is also coming from the community. So it's really stacking on top of each other. So it's going to paint a very comprehensive picture of the systems. So thank you so much for bringing up that last piece that will be very important.
Okay, thank you. We have two more questions. Dahlia, did you have your hand up first? Okay, if you can do one question each, please. And if we have any further information that we need to impart or any questions, please email Kristen Donovan. Her email is up on the screen so that we can listen heard and also get a response from that in the outboard team. Okay, so go ahead. Dahlia, then Elizabeth, then Jennifer. Okay.
Thank you for your presentation. I just wanted to ask if you guys measure the quality of care and if the patients get any better with this survey.
I'm sorry, I couldn't hear that question very well. Could you repeat it?
I wanted to know if you guys measure the quality of care and if the patients get better.
We did not measure quality of care. However, we are hopeful that the hospitals are doing surveys and are collecting that. We'll find out when when we go to the next phase and we're getting the stats from all the different agencies. We will certainly report out if they are assessing with any kind of a satisfaction or an exit survey. We plan to pull that data from the hospitals and places that are seeing patients directly. Thank you.
Okay, Elizabeth? Then
Yeah.
Jennifer.
Thank you, Janice. My name is Elizabeth Stone, and I'm a person who has lived experience and expertise of having been diagnosed and used voluntary inpatient services, as well as made several suicide attempts. So that's the perspective that I'm going to be looking at this, as well as being a provider, a licensed provider for over 20 years. I'm really, really disappointed at the way that you're defining stakeholders, that people that use services aren't stakeholders, and some of your definitions I'm really concerned about, and I'll be emailing you to speak more directly. But what I, in this moment, would like to just highlight is, as I hope you're aware, probably are, the state is making major changes to the way that behavioral health services are going to be delivered. So I encourage and hope that as you're parsing the data and gathering information, and as you think about recommendations, that you'll be taking into account the way that services are going to look very, very differently than they are now. And especially the kind of convergence of people needing housing and just it's so much is going to be changing. So I just really hope that all of this time, effort, and resources will be directed toward the future of the way services are going to be looking rather than specifically now. And just quickly, I want to, I agree with Chris. I really hope the contract gets in the minutes so it's available to everybody. Thank you.
Thank you, Elizabeth. Jennifer, let's wrap it up. Thank you.
Thank you, Chair. Thank you so much for your presentation. Just a few things. I was noticing on your PowerPoint that you have listed the number of interviews that you did with providers, but you don't list the number of interviews for community. So I wanted to know if on the next presentation you can put the actual numbers that you have actually interviewed. That would be possible. I'm concerned about the number or the participation that you're getting for such a large county of 800,000 people, that the amount of interviews done for the community is so low. So extremely low. So I just wanted to find out, maybe perhaps you said it, to get surveys done by community members, are you going to each outpatient clinic? Are you, how is that survey being pushed out and followed up on?
Thanks, Jennifer. Go ahead. Kristen?
I think.
Alex, go ahead.
Thank you so much for that question. Yes, so we're taking multiple strategies to be able to get that community survey out. So we are utilizing and hoping that providers are able to push that survey out. In addition to that, we are planning in-person data collection opportunities within the community at different types of community events as they present themselves, as well as through hopefully word of mouth from different community members, from all of you sharing the community survey or sharing the existence of the community survey. So we're open to any kind of strategies, and we're taking some on our own to ensure that that survey gets out.
And the healthcare, yeah, the healthcare agencies sent it out to, I could get the number, but I think hundreds of providers, asking them to share it through their social media platforms. We want the survey to be distributed as widely as possible. We do have some folks on the ground that are actually encouraging youth, our LGBTQ community, our veterans. We have different folks that are really pushing the survey, but if members of this Behavioral Health Advisory Board could also encourage, like I mentioned earlier, I think that also gives some merit to people being comfortable taking the survey, because we do want to hear from as many folks as possible. And it'll be in the field until at least the end of December, and it may stay open until June. If that needs to happen, then absolutely will be open until June of 2024.
Kristen, can you share the link with us? Can we have a copy of the survey?
Absolutely. Yeah, absolutely.
Drive some engagement as a board if we could have the link and push it out also.
Yeah, we'll get that to you, Janice. Thank you.
Okay, thank you, Kristen. Thank you everyone for participating today, and thank you so much Valcor and everyone for your wonderful presentation and for being so flexible and open into hearing from our members and members of the community. We have one public comment. Stuart, would you like to just grab a microphone somewhere? If you could. Okay, here's one over here, Stuart.
Hi, I'm Stuart Fiedler, a client network volunteer. With regard to customer service, there was a questionnaire given out to all people at Behavioral Health North that they do every year. So there are questionnaires out there. And with regard to service, there's the wellness center that I know of, Behavioral Health South, Behavioral Health North. So there's that too.
Thank you, Stuart. All right, thank you again, everyone. And then our next agenda item is our director's report. So, Director Gilman.
Thank you, Madam Chair. So it's been a busy month since we spoke last. I did just want to start off by saying I had the pleasure of meeting with the Ombudsman work group. And the purpose of that, as we discussed in the last meeting, was so that I could really understand the issues that the worker had talked about, because I didn't want to build workarounds for systems that don't work. I'd rather go back and address the systems and make sure that we first address those issues, and then we can essentially have a better understanding of what problem we're trying to solve. If the problem is the system doesn't work, let's work on that. If it's something where there's a resource that's needed, we'll work on that. So I've got a lot of great information. We generated a lot of great ideas. We'll be reducing that to writing, so that we can so that I can report back, essentially. And Ratan and Liz, I want to thank you, for the great discussion, the frank discussion. So that was wonderful.
Thank you.
Yeah, related to that, we can all do the happy dance. I don't know if any of you want to, happy dance. I actually think I did break out into the happy dance in the executive committee. One of the problems that we've been trying to address for a long time has been the front door. And as you see in the comments, the waiting times, the dissatisfaction with that. And a big part of that was a system, not people, but really a system that we were required to do, having a full assessment in place and other things that CalAIM has changed and opened a door for us to do something different. So our executive team, our managers, and our staff went to work on restructuring our front door, decentralizing STAR, taking those FTEs and moving them into the clinic. And then, as was reported before, really moved into more of a short-term urgent care model for the front door. We had well over 300 people that were, in our system, but we're waiting to get through that assessment process to finally get to their therapist, to finally get to a psychiatrist. The team came up with a new model of, instead of protecting psychiatrists at the end of the steps that folks have to go through, we wanted to shift them more to the front of the line. And not have to have somebody go through, as was required back, we'll call it back in the old days, a complete full assessment process before they were able to be opened. And more importantly, I won't say more importantly, but we have to keep the lights on before we could start billing for services. CalAIM opened up a door for us where we can bill for services right from the screening. We're not required to do the full assessment anymore. So the teams took that and ran with it. I'm happy to report that as of Friday, all 300 people had been contacted or received an email a letter on how they can either walk into a clinic. Anybody that was contacted, and well over 60% of the individuals were contacted in person. They were given an appointment, or they were instructed to walk into the clinic closest to them. And so that 300 plus list is gone. So the last appointment that people have to wait for is August 28th. So all of those folks that were waiting. So that was the big,
Yeah, let's do it.
yeah, it was, I really have to thank our staff. It was an all hands on deck effort. People have asked me, when are you gonna put out the new information? There is no new information because we fixed a system that was broken. Broken might be too strong. We were able to make the system work for people. So there's no new phone numbers, there's no new processes. When people call, they're going to get into where they want to go within a relatively short period of time. I also wanted to mention just some maybe not so exciting things, but other things that you have asked for. The out-of-county placement report that comes quarterly, that was included this time. I know there was various stakeholders that have asked for that. We have the other piece I want to mention, MHSA reform, or 360 or 326 as it's being referred to, the governor's modernization of the millionaire's tax. There's a lot of stuff that's floating around about it. We have held for a minute on scheduling our public information meeting because there is a tremendous number of amendments that have been introduced in the last couple of weeks, and the governor's office is being responsive to some of the big items that the different associations had asked for. The children's associations have been the ones that have really come forward because they were the ones that were really, kids were the ones that were going to get hurt the worst. And so there has been some flexibility expressed by the governor's office to change some of the percentages and also to allow a bit more local control. Now, what does that all mean yet? We don't know until the amendments have been introduced, and we'll see. Everything is still going to go at this point to the voters in March, and there are various organizations, various state associations that have come out in opposition already. So I don't want to throw the baby out with the bathwater. There's a lot of great stuff in there that we would like to see. One of the great things is, and this is I guess my concluding comment on 326 and MHSA reform. One of the great things was that substance use disorder has been added as a required population that we serve. We've wanted that for a long time. Negative side of that is, ain't no more money coming with it. And so if you understand desserts, like I understand desserts, if there's only so much dessert and more people get the dessert, that means that somebody's going to get less. And so if there's one issue that is still a big issue, it's where's the funding going to come from to support substance use requirements, not optional for counties to do it, requirements to provide the same services, the same level of services. So it's good, but the devil's in the detail on the funding. So keep that in mind. Related to substance use, in terms of some of our CalAIM updates, one of the, let me just say, CalAIM, said this before, it's just a whole series of Medi-Cal waivers, a whole series of projects. And for those of you new to the board, a waiver is basically the state's proposal to the federal government on how we want to do Medicaid. Medicaid is a federal benefit. When states want to implement a new program, they submit a waiver, as California does. They call it CalAIM, Medi-Cal in California. And there's so many Cals, and then CalAIM is just a whole series of different waivers that the state's putting in. One project that we're going to participate in is an integration project, and that is where counties can opt in and volunteer to work on the red tape that needs to be addressed at the state level, so we can begin to bring substance use and mental health services together. That's going to be a process, working with the volunteer counties to go through contract requirements, performance improvement requirements, all of the red tape that makes it impossible at times for us to do really good integrated work on the ground level. And so things like billing codes, timelines, how do you do treatment plans, all of that stuff in our contracts at the state level are different. So for us to do real integrated care, we got to get that red tape in place. So we're opting in and going to volunteer. The other update from CalAIM is another waiver called BH Connect. BH Connect is also really exciting. It's again more change, but it's a great opportunity for us to expand community-based services, to do ACT to fidelity, to add things like supported employment. And in exchange, I guess the incentive for counties really to move forward with this is that then we could also bill Medi-Cal for institutions of mental disorder or over 16 bed facilities. So for example, this is Del Mar right now. It's all realignment dollars. There's no billing of Medi-Cal for that facility. This would allow us, if we went forward, to be able to also draw in Medicaid funds or Medi-Cal funds for inpatient services that are over 16 beds. So that's also a great thing that's coming our way. Just a final note I wanted to say about our Port Hueneme building purchase. Unfortunately, that went south as the process moved forward. The good news is there's a vacant lot that's closer to the target neighborhoods that the county is currently exploring. When the board approved the purchase of the Port Hueneme building, this was listed as a potential backup plan. And it's a vacant lot, so we can build, we don't have to try to retrofit and fit in and pay demo costs and all that kind of stuff. So while it's disappointing, it's actually, I'd say it's more half full than half empty. It's closer to the target neighborhoods and we can build it from the ground up. So this concludes my report, and there's lots of stuff in the written part of it. If you have any questions, I can take those now, depending on where we're at with time.
Okay, are there any questions for Director Gilman? Yes, Diane.
I know I'm probably stating the obvious, but this going to the voters is gonna be confusing enough. Especially, and then if there's opposition and you see those commercials of Ford against everything. When will they nail it down so we know what it is? It's gonna go before the voters. Do they have a timeline on that?
Yeah. That morning. That morning. I'm gonna do my best in early September to summarize where we're at. And do a presentation for the community. I'll probably invite our state association. If I were to do it today, I would say this is what it is, but that's changing, you know, and so we'll do our best to do a summary for you all beginning of September. And then as things happen, you know, we'll go from there. But you know, this is bazillions of dollars, high stakes, you know, so there's a lot of political pressure coming from all sides.
Right, which is why the voters often vote no when it's a high dollar item that they don't understand.
Yeah, exactly.
Elizabeth, go ahead.
Hi, thanks. So as some people probably know, I'm following these bills all the time. I'm actually leaving for Sacramento tonight because there's an informational hearing in the Senate. And they said, I mean, there's every week, there's informational hearings on SB 326. So there's an informational hearing in the morning, then there's the like feedback and stuff in the afternoon. And again, that's why I'm really hoping that Valcourt is paying attention to this, right? Because the politicians are very keen on supporting Newsom to get this passed, right? So it'll pass as a bill, right? And then there are changes in the bill, but then the bill is written so that if things pass on March 5th, 2024, half of the provisions in the bill expire, and then the new provisions take place. So it's very, very interesting, and it's part of all these other things that you've been talking about. But one of the things, and again, why I'm kind of encouraging this cross thing, and I'm really glad that Barry's here, is the prevention money is going to be overseen by public health because it's population-based prevention. So every move that the state's making is involving multiple agencies, right? So housing is going to is being brought in through CalAIM with transitional rents and all of it's just a total transformation of anybody who's touched in any way by mental health concerns or substance misuse. So that's kind of where we're moving, and I really hope we're looking at that. So it's and I just want to say I'm actually kind of glad that we have a vacant lot to build on instead of have this ending pit of like removing asbestos and trying to upgrade buildings. We've just seen like every time we get a county building to modify, all of the money goes into trying to make it usable because of, the lack of maintenance, asbestos, all of this kind of thing. So it's kind of exciting that we can dream something and build on it on a lot with community input. So it's just kind of wanted to share that. I've been trying to, and I know Janice is also, we're kind of sharing as all the updates come in with all these multiple bills. So I hope you guys are, getting some of those reports. Thank you.
Thank you, Elizabeth. And we do send out any of the reports that come from the state in a timely manner. Thank you, Jackie, for doing that for us. It's a lot of work for her, but we appreciate you very much. I also wanted to, before we go to the board member comments and announcements, I did want to introduce the healthcare agency head guy, the director, Barry Zimmerman, who's sitting back there. Barry, let's stand up. Thank you for coming today. We really appreciate your being part of our BHAB meeting this afternoon and everything that you do. We appreciate it very, very much. Okay, next board member comments and announcements. Anyone have a board member comment or announcement? Please raise your hand.
Yes, so Spirit of Santa Paula's Harvard Shelter is having a celebration on completion of construction called the launch pad, which consists of more office spaces, laundry facility, conference room, and additional restrooms and shower units. That will be held on this Thursday, August 24th at 11 a.m. located at our facility. And if you would be interested in going, you could RSVP, that information can be that.
Congratulations. Thank you. Actually, we have flyers and we sent out flyers about that, and I really encourage anyone that is interested in seeing the best shelter in our, I shouldn't say that, one of our best shelters in our county, please attend. Okay. Take that back. I don't really know. Haven't been to all of them, so I don't. Okay, thank you, Nelly. Appreciate it. Any other announcements? Yes. Michael.
Yeah, just real quick, I just want to clarify, is that, my role at the Public Defender's Office is I'm one of 4 chief deputies. And I oversee all the specialty units, including mental health, both at the criminal courts and at the hospitals, and probate conservatorship, juvenile delinquency, and our immigration unit. So I didn't want it to be represented that I'm the chief public defender, so I'm in charge of the entire agency, I'm part of the executive staff. So thank you.
Okay, thank you for that clarification. I also wanted to thank Sergeant Pusey and James Espinoza for coming today. I'm sure that this week was very hard for all of you. You're part of the law enforcement team, and we appreciate you coming, and we thank you for your service. And any other veterans that may be, or law enforcement that may be on this Zoom call. So we appreciate your service. Thank you very much. Okay. All right, next we have BHAB committee reports, and we actually do have time for those. So that would be great. Oh, so sorry, Jennifer. Oh my goodness, I could not miss you. Go ahead.
Thank you, Chair. So I've been, looks like we have a opening in District 2, Jeff Farrell's on district, and he's still working on that.
Yeah.
So we'll keep in touch with him. Have a few announcements with some things coming up that are important to talk about. On September 12th, the 8th annual Suicide Prevention Pathways to Healing will take place at Oxnard College Performing Arts Center, 4000 South Rose Avenue in Oxnard from 4 to 8 p.m. Walk with Us Out of the Darkness to Prevent Suicide will take place at the Ventura Pier on September 23rd. Check-in is at 9 a.m. And then with over 181 deaths in Ventura County from fentanyl in 2022, public and private agencies are working harder than ever to stop this epidemic. On September 27th from 6 to 7:30 p.m. at the Ventura County Office of Education at 5100 Adolfo Road in Camarillo, VCBH and the Superintendent of Schools, Dr. Cesar Morales, will be hosting a Facing Down Fentanyl Town Hall for the community. Community members are invited to learn the latest about the continuing fentanyl crisis and how county agencies are pulling together to stop the epidemic. Dinner and refreshments will be served. More information will be coming in September. Thank you.
Thank you, Jennifer. Appreciate all of those announcements, and hopefully some of us can attend these very important community events. All right, next we have community reports, and I wanted to mention that we'd like to see if our BHAB committees can devise 3 goals or 3 goals or priorities that you would like to see the BHAB work on as we end this coming year and go into the next year. The work that we do, a lot of it is done in the committees, and we've done this before and it was very successful. And how it works is you would go to your committees and talk about the goals and the priorities that you would like to see happen. We have a lot of asks on our board. And then you would bring those 3 priorities back to our board and we would take, I guess there's gonna be 18, around 18, and then we will vote on the top 4. And then that does not mean that we can't work on other areas in our committees and on our own, but if we want to, we can write letters from the BHAB. There are a lot of things that we can do as a collective board. So I'd like to know if we can possibly do that. That would be great. And then we'll bring it back and we'll start doing some really good, hard work on our board. And so with that, I'd like to have our committees give their reports. So let's see, first we have. First is prevention. I think you've heard me speaking a lot, so I'll go last. How about youth and family, Kevin?
Thanks, James. Youth and families, we met actually last week, but we did not have a quorum, so we didn't take any action. But we did have a nice discussion. In fact, you set it up well. Kind of the takeaway was we feel it's time for us to kind of talk about what our priorities are coming into next year. So that works out well that you're asking us now to kind of task us with the 3. And I think our group's well positioned for that. In terms of general comments, I think we always get an update from staff, and I think they commented that some of the vacancies that have been empty have been able to be filled. That's an ongoing challenge, but clearly, the demand on our county's system, particularly for youth, continues to go up. So that's an ongoing challenge of meeting that demand. It's later in the agenda, but since it affects us, I did want to say thank you that the recognition of the supervisors did approve the expanded funding for the wellness centers. That's something that we've discussed in youth and family, and it's been a real success story. And so the fact that this will allow additional wellness centers, these are on-campus facilities. I'm oversimplifying it, but what's always stood out to me about them, what makes them unique is that they're peer-driven. It's really the students create a facility that they're comfortable in. They work with each other if they need a respite, if they want just to talk, if they just need a time now they're having a hard time. These wellness centers are there for them. And I think it's grassroots or it's student driven rather than adult driven. And if you've dealt with any teenagers, I think that's a better approach. So thank you for that. And it's happy to see that expansion. That concludes my report.
Thank you, Kevin. Yes, Nick.
I'm really sorry you didn't have a quorum. I had signed up to be on youth and family committee and I was told I wasn't on it when I had minor surgery that morning and wanted to come in by Zoom and they said I wasn't on that committee. So I don't know what the process is. That's what I had signed up to do. So I'm sorry. I thought I could do it by Zoom with the surgery. So apologize for your lack of a quorum.
No problem. It wouldn't have made a difference. So thank you for asking. We'll definitely have you at the next one. We're every other month. I believe you have to attend a couple, I think, before it sort of becomes formalized, but everyone's welcome. That extended to anyone who wants to join us. We do meet in person under the new laws like we are today. So that might have been with the Zoom scenario, but you're more than welcome. So we'll talk offline.
Okay, thanks. Thanks, Diane. Okay, so Elizabeth, the transitional age youth take report.
Hi, we met last Wednesday and one of my goals as the chair of that committee is that I act as a facilitator, whereas in this meeting, I act as an advocate, but in that committee, I'm a facilitator. So it's really just an open forum and welcoming to a variety of points of view without me expressing my point of view. And as such, I've kind of structured the committee so it's a lot of resource sharing. Right, one of the main presentation we had on Wednesday was from one of the people that received a mini grant and was talking about that. We got a brief update on some of the other mini grants. Actually, I thought John was going to distribute some information on that because they're looking at kind of sharing the target, and excuse this really clinical language, the target population for each of the mini grants. And then Jen Harvey always does an update on what's happening from the housing continuum of care. And then people get to really share resources and funding opportunities. Anyone who does have a connection with people between the ages of 16 and 24 who've been housing insecure or experienced being unhoused within the past, I think it's 2 or 3 years, are really needed to support the continuum of care for their youth action board. It's a prerequisite to get funding from HUD, the Housing and Urban Development Federal Agency, for us to have a youth action board to be able to submit requests for this competitive funding. Once we can actually get that funding, it's renewable. So we know that there's quite a number of young people aging, especially aging out of foster care, that need housing services, but we can't apply for the funding without the youth action board. About 15 to 20 point, well, maybe 10 to 15 points in any HUD application now requires the involvement of people with lived experience, which HUD identifies as housing insecure or being unhoused within the past 7 years. So since I was homeless with my kids when they were young, that doesn't technically count as lived experience for those grants. So just really encourage people that are interacting with people that have those lived experiences. Jen's really supportive, and again, that's one of the projects that the organization I'm coordinating gets funding for, and we just got renewed 2 weeks ago for another year, to making sure that people with lived experience get training and policy and participate in the committees and helping set outcome metrics. Somebody was asking about quality of care. This is part of what's driving the mental health services modernization. We don't have outcome metrics. We're measuring performance, but not outcomes. So there's just lots of opportunities, and that's really kind of the stuff that happens in the committee, and everybody's really welcome. Thank you.
Thank you, Elizabeth. Will you be able to discuss with your committee the next time you meet what your 3 goals or ideas that you may want that we have to work on?
I'll discuss that with you later.
Okay, thank you very much. All right, I want to see, is Chris Tejeda still on the call? No, okay. I wanted to congratulate Chris. Chris became a daddy for the first time 2 days ago. So, and we are BHAB members, we are colleagues, but we're also human beings. So congratulations, Chris. Okay, sorry, the August Prevention Committee report. The Prevention Committee discussed and approved its annual report. We had an informative and educational presentation by Erica Fernandez, who is a community services coordinator of substance use services, entitled "What You Need to Know About Fentanyl and Opiates." A lot of what she presented will be also presented in more depth during the Facing Down Fentanyl conference that we're having, or town hall that we're having, but she did a great job. And I just wanted to mention that what they do is in the substance use services area for outreach is they attend job and health fairs, schools, conferences. They give presentations to other communities. They speak with providers and organizations. The staff asks and answers questions about opiates, such as, are you aware of what an opiate is and what do they do? Her PowerPoint provided answers to these questions and explained what opiates are, the type of opiates, including fentanyl, the stages of addiction, what happens during an overdose, and how, despite naloxone distribution throughout our county, that taking as little as 2 milligrams of fentanyl can be fatal. You can't tell if it is in a pill or not in a pill. You cannot smell it, it is tasteless, and it is extremely dangerous. Pills laced with fentanyl look exactly like real pills, which are prescribed by physicians. Fentanyl laced pills are sold on social media, including Instagram and Craigslist. And of particular concern, they are now being sold in some pharmacies in Mexico as legitimate prescriptions. So I know a lot of people do go to Mexico to fill the prescriptions, but be careful.
And let's see, all right, so that was pretty much her presentation, and I wanted to mention that but they have developed test strips now that can test if fentanyl is present. So education within the Ventura County community is key, and we want to spread the word about this very deadly situation. So that was it for prevention. We will be having a Ventura County Office of Education will be presenting on their outreach in the schools in September. So I hope that you'll all attend. And that's it for the committee reports. Oh, question, Elizabeth?
Yes, thank you. Can we hear a little bit more, and I don't know if this would be from you, Scott, about the test strips, like, yeah. Thanks.
Sure, and actually, thank you for asking. I was looking for an opportunity to jump in.
That's not.
The test strips fall under what's called harm reduction. And the concept is we can't treat, rehabilitate, celebrate somebody's first anniversary of sobriety if they're dead. And so the test strips are available pretty much to anybody in the community. If you would like test strips, we can definitely arrange that. I see our prevention staff are on the phone. They're cheap, they're small, people can carry them with them, and they will save lives. It's essentially just literally a little strip, mix a little bit of whatever drug they picked up on the corner, unfortunately, whatever that happens to be. And if it has fentanyl, it'll test positive. So there's instructions that we can get. So yeah, if anybody has any interest, I would love to see them like candy dishes around, so that we can stop people from dying and then move on with with additional treatment and prevention activities. Thank you for asking.
Thank you. Go ahead.
So whether Aegis and those companies that provide care, do they have those strips and do they encourage their students?
Yes.
Nice. Great questions. Go ahead, Elizabeth.
Somewhat related, I know that we got funding to do medication assisted treatment starting in EDs when people come in for overdosing. Do you have any updates on how that's going?
I don't, but I can follow up on that.
There's one other thing that I'd like Director Gilman to speak about, and that is the VCMC's new detox beds. And if you could please give us the guidelines about those, please.
Yep, so that program is scheduled to open in early September. And so I always talk about the money. In our world, in the Medi-Cal benefit that we have to pay for isn't really detox, even though we call it detox. It's more of a social detox. Most of them don't have nursing staff. There's even a weird restriction on having primary care services offered in the detox. So it really is a social detox. In the Medi-Cal insurance benefit acute care detox, the standards for that are so high. Things like IVs, ventilators, severe, that benefit is pretty much silly. They're not able to operate it. So California has been looking at how do we get around that? How do we build something that people that have medical complications and cannot just go into a social detox? They need nursing monitoring, they need medications, maybe more, have serious health issues. Ventura County Medical Center, Dr. Khan, we're just blessed to have him in this community, addictionologist, has put together a program where they'll have 8 beds, and they've figured out mechanisms to provide the service under a medical acute care admission, like high blood pressure, seizure risk. Many of the people that need detox also have, are medical trainers, for lack of a better word. And so that'll open. It's the first in the state. It's pretty groundbreaking, to be honest with you. We tried to pull this off in San Mateo with a hospital that had a vacant detox unit, and we were not successful in moving it forward. So the fact that, Ventura County Medical Center, has pulled this off is really, really a big addition to the community. And that'll allow us to continue to build out our detox programs, our crisis stabilization units, but with a real understanding that this isn't a place to go if somebody's, having chest pain and they're withdrawing from alcohol. That would go into a hospital. So, obviously excited about that. We're gonna do another happy dance in September. We'll do a happy dance in September.
Yes, please.
I'll just add on to that. I just met with Dr. Kwan 2 weeks ago, and like you said, it's really the state of the art, first of its kind facility in Ventura County or in the state. And as you mentioned, the hardest part is getting people to qualify for the treatment, but there's plans in place to expand that to 18 beds as soon as they can kind of get through this initial pilot phase of 9 beds. But there's plans in place to double that to 18 once this pilot phase ends, and it's again, funding and working on these requirements for people to qualify for this level of treatment is going to be the tricky part. But as you said, we're so fortunate that Dr. Conley's an addiction medicine specialist and really ahead of his time when it comes to these kind of programs.
What insurance? Thank you. The question was what insurance did they take? Any. All right, well, thank you, and thank you for that update. I knew that was happening. I just didn't know the details, and I knew that there was some caveats around that too. So thank you for that. All right, next on the agenda are site visit resumption. I wanted to know if anyone, we've talked about conducting site visits for quite a long time now, and I wanted to know if there are any BHAB members that would like to conduct a site visit. If you would, please raise your hand. Elizabeth?
Yeah, I'm very eager to visit the inpatient unit and the crisis stabilization unit, the IPU and the CSU, because I haven't visited them in this county.
Okay, great. That's wonderful. So if you could please ask if you'd like to do it today, you can. Any other BHAB members that would like to join you? We've usually not had more than 3 or 4 BHAB members accompany the lead on this because it's too overwhelming for the facility. But we have forms, and I believe you have copies of the forms. If you don't, Elizabeth, we can you have copies, okay? That would be sent to the facility and so on and so forth. So go ahead.
And then we asked Jackie for the contract.
Yeah.
Okay, that's the protocol for the contract. Okay. All right. Yes, if anybody, and I don't want to take time, but if you could please see me afterwards so that we can exchange contact information if you'd like to. Also visit the inpatient unit and the CSU. Thank you.
Okay, thank you very much. And it'll be the lead's decision. If we have like 13 members that would like to go, it'll be your decision as the lead on the site visit who can accompany within the 4. Okay, thank you. All right, anyone else? Dahlia.
Yeah, I just wanted to join her when she was. Yeah, I wanted to join whoever wants to go for a site visit. I would love to go.
Okay, thank you. Yes, Liz.
Hi, so I need a little clarification because I'm not always sure about this, but are we allowed to go to a lot facility and we go to Horizon View?
Yeah, we have been there before. Yes. We advise the facility that we're coming and.
Right, so I understand.
Okay,
Yeah,
yes.
but I just didn't know if that was in our purview, so I would like to go out and see the life. I like to go out and see the Horizon View.
Okay. All right, so same situation. Anyone who would like to go to the Horizon View site visit, please contact Liz Warren. And then you'll send the forms to the facility, et cetera, et cetera. I think you've done that before.
That's the one at the airport, Liz?
Yes, ma'am. All right, great. That's 2 site visits of very, very important providers. So thank you both for stepping up and leading these site visits. Very much appreciated. Okay, let's see. All right, new business presentation requests. In September, we have Chief Raina West, who's Substance Use Services. She's going to be speaking a little bit more on CalAIM. And she will also be presenting bi-monthly update. If you have an idea for a presentation, please submit it to Jackie and myself. I know that we do have a couple. We had a Valcor today. Thank you. Rain in September, we're looking to book Gold Coast to speak on Cal AIM and also Pacific Clinic's Tay Tunnel and also the Stepping Up initiative with jails. So we will get back to you on those three. But if you have any other site visits that you would like to, I'm sorry, not site visits, presentations that you would like to see, please email myself and CC Jackie or CC Jackie and email and CC, right, Jackie and CC myself. Either way, it doesn't work. It doesn't matter. It works either way. Yes, go ahead, Elizabeth.
I think you.
Not turning off.
I'll just be loud.
Oh, yeah, all mine's are. Jackie?
Okay, good.
Thank you, Jackie.
Yeah, I think you had mentioned, and I just really would like to emphasize, the request for someone sharing the, experience of, veterans. It's a very large, part of our community, and a lot of people are in distress. And I would kind of encourage maybe November with Veterans Day, that we kind of prioritize that and make sure that we hear that as soon as possible.
Actually, James and I have been discussing having a veteran presentation. And even though it's not on the list that Jackie has, he and I have been talking about it. So go ahead, James.
All right, thank you. Yeah, I've kind of working behind the scenes. I actually have 3 people who are willing to speak. Again, that's dependent on the dates, and each one has a slightly different topic. So I'd need to coordinate the date and then get a commitment from one of those 3. Ideally, I'd like to have all 3 of them present over the next, at some point over the next 12 months, but very compelling. The most important one, I think, is understanding veteran culture. This gentleman presents from the perspective of an Iraq War veteran 2 times and an active police officer. So I think to shed some light on just current veteran issues would be very helpful. And I have obviously some other treatment options in the background.
Okay, well, we're going to get that on our calendar, James. So let's talk offline and we'll set it up and put it on the agenda. Okay.
Yes.
But you can go ahead and ask. We'll talk about the date and then.
Yes, I'll send you an email with 3 options.
Sounds great. Thank you very much. And I like the idea about November. If we could work that out, that'd be great. All right, anyone else? Okay. Next we have. Let's see. We have recognition award recommendations. If anyone has a recognition award recommendation, please send them to Jackie at bhabadmin@ventura.org and CC myself at janice@panacea-ent.com with a brief description of who the person is and why you believe they might qualify for a BHAB recognition award. Next, we have our contracts.
I think we missed the annual report.
I'm so sorry, we did miss the annual report for Michael Rodriguez. Thank you, council.
Speak louder.
There you go.
All right. For the committee chairs, I would encourage everyone to get me, I sent out an email, sent out a reminder email this week as far as list of priorities, list of gaps that come within the purview of your committees to me so that we can compile the annual report to present and submit to the board of supervisors. So get that to me as soon as possible so that we can get that out. Thank you.
So Michael, are we not using the form then? The form that you sent out initially?
We are using that form.
We are.
Essentially, those were the issues that were identified in that form.
Right, thank you. If anyone doesn't have the form, they can reach out to Michael or myself and we'll send it. Thank you very much, but it would be great to get these in to Michael as soon as possible. Diane, do you have a question? Great, all right. So, public comments. Are there any public comments from anyone? Yes, ma'am. Yes.
Esta es una como sugerencia. A lo mejor no sé si vaya a ser bien la pregunta, pero una de mis preguntas me gustaría que varias juntas aquí. He estado en algunas juntas aquí y no había bastante participación de la comunidad. Pero, porque los problemas están allá afuera. De poder para poder solucionar esas situaciones que están allá. Estaban hablando ahorita de colaboración con organizaciones y agencias. ¿Qué posibilidad pudiera existir que un miembro de esas organizaciones estuviera aquí presente? ¿Por qué? Este es un equipo, un equipo. No podemos estar aislados los unos de los otros. Ellos forman parte de un modelo, parte de un movimiento. A mí como comunidad me gustaría conocer esas organizaciones, esas personas, para yo poderme dirigir, para ver cómo piensan, para poderles explicar las necesidades directamente de lo que es una comunidad allá afuera con necesidades. No podemos estar desconectados los unos de los otros. Si nosotros realmente queremos lograr un cambio en nuestra comunidad, necesitamos unirnos y conectarnos. Ahora, la otra cosa es, desde que hace tiempo hemos platicado con el señor Scott acerca de una necesidad en nuestra comunidad de primeros auxilios de salud mental en nuestra comunidad. No para que no para ser consejeras, ni psiquiatras, ni psicólogas, simplemente para tener el conocimiento básico de poder ayudar a nuestras familias o simplemente a nuestra comunidad. He estado participando en algunos entrenamientos de desastre y me puse a pensar con lo que pasó ayer, ¿qué pasaría si realmente llegara un desastre fuerte aquí en nuestra comunidad? ¿Quién va a ayudar a atender a las personas en el lado emocional que entran en crisis, ansiedad y nerviosismo? Gracias, sé que el tiempo es limitado, pero muchas gracias y tomen en consideración la comunidad.
Muchas gracias. thank you very much. And Director Gilman, Madam. Sorry. What is your name, please? Maria, thank you very much for your comments. Director Gilman will be speaking to you after the meeting. Thank you so very much for coming out today. And thank you, interpreters. That was great. Thank you very much. All right. Our recognition award will be, we have a 3 o'clock as soon as the family arrives.
Family is here.
And the family is here.
They've joined us.
Wonderful. Okay. So that's wonderful. I wanted to mention that this next agenda item is for posthumous BHAB recognition award for former 5th District Supervisor Carmen Ramirez.
Excuse me. Yeah, sure, Carmen. Carmen, the members would like us to wait till 3 o'clock because they do have other family members coming.
Great.
So can we take a moment, 5 minutes or so?
I was just going to suggest, if the family is not here,
Yeah.
why don't we take a 5-minute break? And we'll come back at 3 o'clock, 7-minute break. Okay, all right, please don't leave. Thank you.
Sam. Yeah.
And I've been a hard time. And I'm wondering. That's still gonna happen no matter what.
I just want to make sure you. I think it's just listening. I didn't know anything about that.
Are you kidding me?
I want to try. Probably better is to try to figure out better. He's doing great. Especially, and he said, yeah. Often, yeah.
Sorry.
Yeah, it's getting ready to go spot.
I don't. That's a good question.
Maybe Thursday.
That's like my understanding.
I did about coming on Thursday.
We actually.
Yeah, and I.
Your tongue is actually.
It's been busy, go busy.
Hey, it's really. Cheers. That's all. They're like, what did you go? Well, this is great. I will. I'll follow this email. Yeah. I'll talk to Jackie.
And then.
I'm sure they're gonna cheer you.
So that's.
I'll take a look. Yeah. So we haven't had this like robust conversation about what there is. I think we'll be able to figure out, carry over what we kind of had before.
Sending out an email reminder email right now. And I figure I need to give flowers.
I just want you to know that you're taking care. That's like, well, thank you, my son. We could use it. I'm sorry for that. No. But it's every other month. Cycle is August, October.
Oh, you know, if I don't have your number. Let me put my phone, so I'll have your number and that way I'll know. All right, because if I don't know, because. So let me make sure that I put your. All right. We're gonna do that. I can't wait till you go to the house again. Or if you're all get
I think that's how we do.
Yeah, I read.
You did that electronic diet.
Yeah. That one I do. Yeah.
Oh, did I miss that? I like that. If everyone will please take their seat, that would be great. As I began to say, our next agenda item is the presentation of the posthumous BHAB recognition award for former 5th District Supervisor Carmen Ramirez. I also wanted to thank our supervisor Kelly Long for attending today. Really appreciate your everything for the county. Okay, so I also wanted to thank VCBH and Director Gilman for providing the food today. I appreciate that. And for Jackie's participation and Andrea's for going to get the food and creating this small reception. Also to Supervisor BNA Lopez's Chief of Staff, Robert O'Reilly, for coordinating with our BHAB's first Vice Chair, Liz Warren, for this important award. So with Liz and Supervisor Ramirez's husband, Roy Prince, and Supervisor Ramirez's sister, Maria Ramirez, come up to the podium, please. And if the rest of the family and friends would like to come up as well, that'd be great. Okay, I'm going to ask Liz to please read the recognition award, commendation award. Go ahead. Oh, you have it. I understand. Okay, thank you.
Before I do that, and if you could join me on the side so everybody can see you, because there's a camera and a big screen. Please feel free to come on up and get closer. Those of you that like to. This is supposed to be a celebratory, nice, fun moment. I just wanted to say a few words to put what we're doing here today in context, because the Behavioral Health Advisory Board worked very closely with Supervisor Ramirez, and many of us worked with her over her years of public service and know that this past year has been a challenging year for close friends and family members. But there's been some things that have happened in memory of Carmen. And I want to talk a little bit about that because I think it's important to, I feel like we're perhaps putting a bit of a period to acknowledge and remember her public service. So just recently, due to the generous efforts made by Supervisor Ramirez's family and close friends, a generous donation of 15 boxes containing Supervisor Ramirez's personal and professional documents and correspondence has been made to Cal State Channel Islands to create an archive spanning 45 years of her public service. The archive will act as a tool and resource for those wishing to know how Supervisor Ramirez thought and fought on issues most important to her. It will also provide a glimpse of life with a significant public service service in Ventura County. There was also the establishment of the Carmen Ramirez Legacy Scholarship Fund for Public Service that was created to continue her legacy and encourage other individuals to get into a life and support public service. Please contact the Ventura County Community Foundation for additional information. They're always welcoming, they're always open to welcoming your donations. After years of planning and coordination with the county, the city of Oxnard, and community partners, in a unanimous vote on June 6th, the Ventura County Board of Supervisors approved the finalization of purchasing the property at 555 South A Street in Oxnard with the intention of establishing the Carmen Ramirez Family Justice Center. It will become the home to the second Family Justice Center in the county. The Carmen Ramirez Justice Center is a collaboration between the city of Oxnard, the county, and the Ventura County District Attorney's Office with an anticipated opening date of summer 2024. And just recently, 7 days ago to be exact, Supervisor Ramirez has been memorialized with a new downtown Oxnard mural located on West 3rd Street across from Oxnard City Hall, where she served on the Oxnard City Council for 10 years. It's really lovely, and I encourage you to stop by and take a look. So we decided as an organization of advocates, stakeholders, community providers, that we would like to also pay tribute to the service of Supervisor Carmen Ramirez. So it is my honor, on behalf of the Ventura County Behavioral Health Advisory Board, to present this certificate of commendation and grant it to Supervisor Carmen Ramirez. The Ventura County Behavioral Health Advisory Board presents this posthumous certificate of commendation to former Ventura County 5th District Supervisor and Chair of the Board, Carmen Ramirez, in honor and recognition of her dedication and unwavering commitment to the promotion of health and well-being within our county. Supervisor Ramirez campaigned tirelessly for improved access to health resources for everyone, exposing the need for more Spanish-speaking and bilingual health professionals. Carmen's compassionate approach and empathetic nature created a safe space for open discussion about mental health and the need for additional services in Ventura County, reducing the stigma for those facing behavioral health challenges. Through her collaborative advocacy and compassion, she was a voice and champion for the health of the underrepresented and most vulnerable members of our community. Her integrity and dedication to selfless public service continues to be a tremendous source of inspiration for so many. It is with our deepest heartfelt gratitude for her unyielding commitment to the greater good and making a difference in the lives of others that the Ventura County Behavioral Health Advisory Board honors the late chair of the board, Supervisor Carmen Ramirez, presented on the 21st day of August 2023. Thank you.
Would you like to say anything?
I'd like to thank the board for this honoring for my sister Carmen. As you all know, she came to Ventura County and worked with legal services, which serves the least of us in many ways, people who could not afford their own legal, private legal advice, the people who came to her for help with their rental problems, their custody problems, and social security problems. But she also came to know the families of the area, not just Oxnard, but in Ventura and Gilmore and Santa Paula and Santa Barbara during her long career. And she saw that so many of those who needed services the most were often overlooked. And she helped to bring greater awareness to the need that we all have to take care of the least of us. If we want a healthy society, it is important that we take care of those who are having difficulty in taking care of themselves. And Carmen had a keen sense for that. And I know all of us here deeply appreciate what she brought to the community, the empathy, the sharpened awareness of the social inequities that many suffer under. So hopefully we all go forward and keep her in memory as we do our work to serve a greater community and strengthen our civilization to be one where we take care of all of the people, not just people who have the means to be cared for, but those who are in need of care. Thank you so much for honoring my sister, Carmen.
Well, Prince, he is Carmen Ramirez's husband.
Thank you all so much for honoring Carmen in this way. Carmen was always aware of the way that Oxnard was generally underserved and worked diligently and I would say daily behind the scenes to encourage all of us to step up and provide the services that you do so well to the Oxnard community as well as other communities in the county. So I'd like to just recognize Barbara Macri-Ortiz and for the work that she did in terms of Carmen's archives, and Laura Cuellar, Barbara's right-hand person, and together they did an amazing job of bringing together many boxes of documents to really create an archives that the university was very happy to receive. And not only did Barbara and Laura call through all of Carmen's papers, but they also created an index that indicated what the particular files were in some of the boxes. So I just thank you, Barbara. That was what Barbara has done is come forward to support Carmen in life. She did, and since she's passed. So so I just and so the Barbara created these documents, and then finally there was an agreement with the university for some of her books and these documents that I signed. So now I understand that perhaps in about a year there will be a ceremony at the university that recognizes Carmen and the archives and the contribution that she's made to all of us, to the community. And again, thank you so much for your honoring of Carmen, so well deserved. And with that, I'll step back. Thank you so much.
I'm going to be seated, but if anyone else would like to come up to the podium and speak, Supervisor Lopez, Supervisor Long, Chair Emeritus, Michael Rodriguez, but first, got it, okay. But first, Margaret Cortese, longtime friend and who worked closely with us.
I worked at the department through the 80s and 90s. I served on the Mental Health Advisory Board, and I was Carmen's friend during all of those years. And we spent a lot of time together walking around the park to try to stay in shape. And I just wanted to know that she took a very great interest in the mental health department and its workings, even before she was an elected official. And it was close to her heart. In fact, one of the first things I did when I opened an office was to evaluate someone that she was representing. And so I just want to say that we were all very fortunate to have had Carmen in our lives.
Michael, would you like to say something?
It's been a year. It's been a crazy year. And over 30 years ago, when I was a young attorney who just opened up his office in Simi Valley, Carmen inspired me to keep this flame that was ignited during law school while clerking for legal aid out in San Fernando Valley, which was to keep fighting for folks who didn't otherwise have access to legal representation in the legal system. And what folks don't understand is, like, on a daily basis, like what I see in my office, is that there's different, unfortunately, there's different tiers of justice. And Carmen, for her entire legal career, sought to ensure that each and every one of us had access to quality legal representation, which is the same thing we do in my office. But this is about Carmen, not about me, but the impact what she had on me and so many other attorneys throughout. She was practicing many years before I came along, but for the last 30 years, she inspired me and others who came before me as well as after to keep up what I call this good fight, to ensure that each and every one of us has access to this justice system. Because if we don't, if it becomes two-tiered or multi-tiered, then it's going to collapse. And so she inspired me. I know she inspired my wife Florencia in other ways of being like we say in Spanish, una chingona, someone who's not afraid, who has the courage to speak truth to power, to take at times unpopular stands, but standing up for what they in their heart of hearts believe is right. And so I'm honored to be here, and Carmen's always, to this day, her spirit lives on. And how I knew her is that she wants us to keep working and doing good work, whether it's improving meaningful access in the legal system, as well as providing meaningful access to behavioral health services that we all show up and try to do. So I'm honored and would like to thank her family, her husband Roy, everyone else, Barbara, who I've had the honor and privilege to collaborate with over the years, and each and every one of them. So thank you.
Supervisor Vianey Lopez is going to say a few words.
Good afternoon, Chair, Board. Thank you for this opportunity, for this moment to be in another space that Carmen, as not just a resident of Oxnard, as a council member, as a county supervisor, as a chair up until her last moments, a space that she really touched, and a reminder of what we all share in common, and what really we saw through the service that Carmen provided was remembering the people, remembering to be that advocate, to be that voice, to be that champion for people who didn't find a place in the space of that we have the power to influence and the power to advocate and make changes for those who don't have a voice, who don't feel they have a voice. And for that, I thank you for giving us this opportunity a year later to look back on times that each of us have reflected and have taken that time to recognize who Carmen was to each of us, and how she influenced who and how we are doing the work that we are doing today. So on behalf of the 5th District, as an office and as a community, I thank you for this opportunity to remember and recognize and honor who Carmen Ramirez was, And it is a place that will forever keep her memory alive. And it is through the work that each of us are doing on a daily basis moving forward. Thank you.
Supervisor Rivera. Say a few words.
Well, Carmen and I were elected at the same time. And when we took our seats in January of 2021, one of the things we talked about is we divvy up a lot of the committee assignments we serve on. Each supervisor serves on about 10 different regional boards and commissions. And behavioral health was something that both Carmen and I had an interest in. And we were divvying out where our assignments were and who had time for what. And so it turned out that it worked out that I was going to take this seat. But it was something that Carmen felt so strongly about. And Carmen's remembered for her advocacy in so many different arenas. And one of the areas which I don't think people in the community truly understood and understand was how involved she was in behavioral health and mental health issues, and how important it was to her that disadvantaged communities and residents who had real mental health challenges and those challenges are real and often weren't being met, and how important it was that as a county, as a community, we worked to make sure those services were provided. And even though she wasn't on BHAB physically, she was here every meeting. I was constantly hearing from her about recommendations and areas that she felt needed advocacy. And of all the conversations Carmen and I had, so many of them came back to behavioral health, to mental health. And I'm really thankful that Liz brought this forward and recognized her just years of contribution to this field and the work she did to make sure, particularly the residents of Oxnard, but disadvantaged communities across the county got the help and the services they need and deserve. And I know it's something that you all recognize. I'm just glad the community is able to recognize how hard she fought in this arena.
Ryan Long was going to say a few words, but I did want to piggyback on Supervisor Rivera and thank Liz so very much for making this day happen. And also Robert O'Reilly's back there. Thank you as well. So
Supervisor Kelly Long, I wasn't going to speak, but it's just a wonderful moment to just share the memories. And Liz, thank you very much. A wonderful certificate. And all of you, thank you. We have been remembering Carmen throughout the years in many different locations, from animal shelter, juvenile justice, here today, and just remembering all the lives that she touched and how everyone was equal to her. Really just caring and how can I help you was really the question. What is the need? And I hope that we take all of that little inside of us each day and remember to really just remember all of those and what they're going through, and just to support, like she had the support here. Make sure we have our village that cares about us, that loves us, and act the same way to all the others. Yesterday we had a great hurricane, and I am so proud for our community because we all take care of each other and make sure we're all good. And that's what Carmen did, whether it's leaving a rose or just, how are you? She was a very special person. So thank you for taking that time to remember. And on behalf of the Board of Supervisors, really appreciate it. All of our 10,000 plus staff really appreciate it. And so thank you.
hey, is there anyone on Zoom that would like to say anything about Supervisor Ramirez? Right, anyone else in the room?
Yeah, no, first here and share the president of Oxnard Union High School District. Yeah, I think you opened it. Right?
Yeah, absolutely. Hello, everyone. Thank you so much for honoring our dear late friend Supervisor Carmen Ramirez. I speak as board president today of the Oxnard Union High School District on behalf of the Board of Trustees and the 17,000 students and the 2,000 employees that we serve. Supervisor Ramirez And before that, Council Member Ramirez and Mayor Pro Tem Ramirez was an incredible advocate for the kids, for the students of our school district, and also for the teachers and staff. She was an incredible advocate. She was my mentor and leader. And when she became chair of the board, she asked me for some ideas about what she could bring for her. I don't remember what you called it when you opened the board, sort of like the goodies of the county. Moments of inspiration. Thank you, Robert. Yes. And she called me and she said, I need some ideas, and she'll get back to me with some ideas. And I said, I don't need to get back to you. I can tell you right now that what I think would be really great is if we can highlight the wellness centers that the Oxnard Union High School District has spent the last 5 or so years developing on each of our campuses. And she was such an incredible advocate. She helped with regard to broadband. We have a lot of students that don't have access, and teachers and staff too. So she was an incredible advocate for broadband in our underserved areas. So again, I want to say thank you. She was I'd like to think that she was my mentor and my leader, but really she was everybody's mentor and everyone's leader. So thank you on behalf of the Board of Trustees. Thank you very much.
With that, we're going to adjourn the BHAB meeting, and we invite the family and all of our friends, BHAB members, and everyone else in the audience to join us with a small reception. Thanks again to DCBH, and the meeting is adjourned. Thank you.